What is ectopic pregnancy? Ectopic pregnancy is a situation or a condition where the fetus, instead of implanting into the womb, it instead implants out of the womb, and most commonly it implants in the fallopian tube. And imagine a baby growing in the fallopian tube. It is so tiny, so this baby cannot grow well. In the long run, it tends to rupture, that's it bursts the fallopian tube, and you don't want that to happen to you, especially if you have had an ectopic pregnancy before. Now, what if you have an ectopic pregnancy? What are the early signs and symptoms of an ectopic pregnancy? The first and the most common sign of an ectopic pregnancy is spotting. Spotting means just mild bleeding. That you do the pregnancy test and you discover that you are pregnant. Out of a sudden, you have mild bleeding. You might just go to clean up after urinating and you discover blood. Once this happens, immediately go to the hospital to check up. It might be an ectopic pregnancy. That's the first. Then the second is lower abdominal pains. Once you have missed your period and you do a pregnancy test, it's positive, and out of a sudden you have a sharp lower abdominal pain, most of the times either on the left or the right, if depending on the side of the tube which is affected. And when this sharp pain occurs, most at times it is usually the sign that this ectopic pregnancy has ruptured. Once you have that sign, do not stay at home. Report to the hospital immediately. The third sign that we can have is a sharp pain on your shoulder, which might be accompanied by dizziness and even lost consciousness. Once this happens, it means that a massive blood has been lost after a rupture has occurred. So you might just discover this, and once it's getting ruptured, it might not even give you a warning sign. It might just happen. You just feel so. This sharp pain at the level of the shoulder is because of the blood which has ruptured and is inside the abdominal cavity, and there are nerves which are present inside the abdominal cavity which is connected to the shoulder. So once that blood touches those nerves, it causes pains at the level of the shoulder. And depending on how massive the bleeding is, if it's heavy, you start feeling dizziness and even lost consciousness. So if this occurs, it's a matter of minutes for you to be saved. So it's a life-threatening condition. How can you do to prevent this from happening? That's to make sure that an ectopic pregnancy is identified early. My best advice to every woman out there is, once you discover that you are pregnant, you do the pregnancy test and it is positive. If it is just the first time you are doing it, and that's 4 weeks, you can talk about 4 weeks pregnant, go to the hospital immediately. Don't wait for 3 months that you want to go and do your antenatal clinic, or I want to go to the hospital when everything is fine, or when I'm 3 months, 4 months, or 5 months. No. Anytime you discover you are pregnant, just quietly go to the hospital. If you don't want to do any other checkup, just tell the doctor that you have come to do an ultrasound scan, which I recommend you to just go for a general checkup once you discover you're pregnant. But my best advice is, do an ultrasound scan immediately you discover you are pregnant. In that light, once it's done, the position of the baby is identified. And if it is in the right place, you are good to go. You are placed on vitamins and on folic acid. Then they continue your follow-up. So it's very important you do an ultrasound scan. Don't assume that everything is fine. don't assume, because once complications are occurring, it's not going to come with a warning sign. Okay, thank you very much. This is about the warning signs or how you can easily identify an ectopic pregnancy. So my best advice to you is, once you are pregnant, go and do an ultrasound scan to determine the position of the baby. If it is an ectopic pregnancy, it is being managed early accordingly. And if it is fine, then congratulations, you are pregnant. If this was helpful, don't forget to share the video, and again, click that subscription button if you have not done. And if you want to have a private consultation with me, you can download the Hospital app and either call me through a video call or an audio call. Thank you very much, and God bless you.